Abortion is a topic that many people have very strong feelings about, but not everyone is fully informed on all the different aspects of the issue. Sometimes it might be difficult to cut through all the noise when it comes to such a controversial topic. So, you might be asking, what exactly is abortion? How does it affect the parties involved? Are there long-term effects? Does it really help the mother? And you also might be asking yourself, where should I stand on these issues? Our hope is that through these modules, after hearing from medical professionals, women who have faced this choice, families that have been impacted by abortion, and people who are on the front lines bringing awareness to this cultural discussion, you could come to your own conclusions and make an informed decision on where you stand. With that being said, here's a story that paints a very vivid picture.
This is Olivia. Though she has yet to greet the outside world, she has already completed an amazing journey. This is the moment that life begins. A new human being has come into existence. At fertilization, her gender, ethnicity, hair color, eye color, and countless traits are already determined. She begins to implant in the uterus about 1 week after fertilization. Her cells organize into what we call an embryo. At 3 weeks and 1 day, just 22 days after fertilization, Olivia's heartbeat can be detected. The buds of her arms and legs appear by 4 weeks. She begins to move between 5 and 6 weeks with both spontaneous and reflexive movements. At 6 weeks from fertilization, her brain activity can be recorded and bone formation begins. She can bring her hands together at 7.5 weeks, and separate fingers and toes emerge. She can also begin to hiccup. At the beginning of the 9th week, Olivia will have grown from a single cell into nearly 1 billion cells, and she is now called a fetus. She will suck her thumb and swallow, grasp an object, touch her face, sigh and stretch. At 11 weeks, she is playing in the womb, moving her body and exploring her environment. Her taste bud cells have matured by week 12 but are still scattered throughout her mouth. Her mother will first sense Olivia's movements between 14 and 18 weeks, an event called quickening. Beginning at 18 weeks, ultrasounds show speaking movements in her voice box. Around 20 weeks, with a lot of help, babies have survived outside the womb. At 27 weeks, her eyes are responding to light. She can recognize her parents' voices and will even recognize lullabies and stories. Olivia has gone on an amazing journey during these last 9 months. She will soon signal to her mother that it is time for delivery and greet the outside world.
Abortion pills have been legal since 2000 and now make up for more than half of all abortions because they're being sold as the more comfortable solution. But abortion pills actually come with many complications and side effects, like severe pain, heavy and prolonged bleeding, fever, infection, and cramping. But these are just the complications that pro-abortion organizations mention. What they don't mention is that abortion pills can lead to blood clotting, described by one patient as the size of a lemon, incomplete abortions, which require a follow-up surgical abortion, pain, sometimes described as worse than childbirth, mental distress, and a fear of dying, and in some cases, the abortion pill has led to death of the mother. This isn't hyperbole. So far, 24 women have lost their lives from complications with abortion pills. And get this, nearly half of all women who take the abortion pill seek medical attention after. That doesn't sound very comfortable or safe, does it? In spite of these complications, abortion vendors have fought to remove safety regulations and to disregard the research that says women have been hurt by abortion pills. But the truth is this: these little pills kill.
When I worked at Planned Parenthood as an RHA, we were told to mislead the women that came in looking for abortion pills. We were instructed to tell them the abortion pills were going to be easy, and we knew they weren't. Still, I was told to go to the grocery store and buy a lemon to show the women how big the clots would get. These women were experiencing intense pain, and they were afraid for their lives.
Many of you probably already knew the basics of the physiology of the journey from fertilization to birth. But what you may not know is the physiology of what happens during an abortion. We think it's essential for you to make an informed decision and to have an understanding of what these complicated procedures entail. Here are two medical professionals who can offer some important insights.
My name is Dr. Kathy Altman. I'm a board-certified obstetrician gynecologist with almost 33 years of experience, and I've completed over 500 abortions. Today I'm going to describe a second trimester surgical abortion called dilation and evacuation, or D&E. A D&E is generally performed between 14 and 22 weeks of pregnancy. Before a D&E abortion can be done, the cervix must be dilated slowly over 1 to 2 days with laminaria or a similar product. Laminaria is a type of seaweed that absorbs water and swells to several times its original diameter. When the woman undergoes the evacuation portion of the procedure, she lies on a table with her legs in stirrups. She may be given injections of local anesthetic in the cervix, IV conscious sedation, or general anesthesia. The abortionist uses a speculum to open the vagina and uses an instrument to stabilize the cervix. Metal dilators may be used to further open the cervix if needed. Once the cervix has been stretched open, a cannula attached to suction tubing is placed inside the uterus. The suction machine is then turned on and the amniotic fluid surrounding the fetus is suctioned out. The fetus is too large to fit through the cannula, so he or she must be removed in pieces with a clamp such as this Soffer clamp. A Soffer clamp is made of stainless steel and is about 13 inches long. At the tip, there are rows of teeth for grasping. The abortionist reaches into the uterus with the clamp and tries to grasp an arm or leg. Once the abortionist has a firm grip, she pulls forcefully in order to remove the limb. Piece by piece, the abortionist removes the arms and legs, followed by the head or the body, including the torso and pelvis, along with the intestines, the heart, and the lungs. The placenta is also removed. If the cervix has been overdilated, the body or even the entire fetus may be pulled out intact. Usually, the most difficult part of the procedure is extracting the fetus's head, which at 20 weeks is about the size of a large plum. The abortionist must open the clamp widely to grasp the head, and then crush it so that it will fit through the cervix. The abortionist knows he has crushed the skull when a white substance, the fetus's brains, leaks out through the cervix. The abortionist then removes the compressed head. Any remaining limbs, organs, bone fragments, or pieces of placenta not removed with the forceps are removed by scraping the uterine lining with a large curette or by reinserting the suction cannula. The abortionist then reassembles the fetal parts to make sure that there is nothing left inside the uterus, which could cause infection or bleeding. Once all the parts have been accounted for, the bleeding has been controlled, and all the instruments have been removed from the vagina, the abortion is considered complete. For the woman, this procedure carries a risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to bowel, bladder, or other maternal organs. Infection and hemorrhage can also occur, which can lead to death. Future pregnancies are also at an increased risk for loss or premature delivery, due to abortion-related physical trauma and injury to the cervix. As I mentioned at the beginning, I used to perform abortions. At the time, I truly believed I was helping women. After the birth of my daughter, however, I realized that abortion doesn't just end a pregnancy, it kills an innocent human being. Such terms as zygote, embryo, or fetus are simply terms that refer to age, like infant, toddler, and adult, and do nothing to diminish the humanity of the child. As I cared for women in my OBGYN practice, I also learned how abortion harms women. I stopped doing abortions because I could no longer kill babies just because they were unwanted. I am now a pro-life advocate. I am proof that anyone can change, no matter who they are or what they've done. I invite you to join me and make a decision to protect the preborn. Thank you for watching.
My name is Dr. Patty Giebink. I've been a board-certified obstetrician-gynecologist for over 25 years, and I've completed thousands of abortions. Today, I'm going to describe induction abortions, generally done from 22 weeks to term at 39 weeks. Because the child is so large and developed, an abortion procedure at this point takes 2 to 3 days to complete. And due to the risks and the need for monitoring, this procedure is generally done in the hospital or a surgery center. On day 1, mifepristone is given orally. Mifepristone blocks the pregnancy hormone progesterone, causing the lining of the uterus to degenerate, starving the fetus of vital nutrients and oxygen. Mifepristone alone doesn't necessarily kill the fetus, so fetal demise is often induced beforehand. This is often only done for babies 20 weeks or older. A syringe with a large needle is filled with a drug called digoxin. Digoxin is used to treat heart problems, but an overdose of digoxin will cause fetal cardiac arrest. A long needle is inserted through the woman's abdomen or vagina, and the digoxin is injected into the fluid surrounding the fetus under ultrasound guidance. The fetus doesn't die immediately, which is why this is normally done 1 or 2 days beforehand. For the drug to be more effective, the abortion doctor can also inject the digoxin directly into the fetus, targeting either the body, heart, or umbilical vein. Potassium chloride can also be used to induce fetal demise more immediately. The fetus usually dies within 24 hours of the injection of digoxin. If the fetus doesn't die within 24 hours, the injection can be repeated. Death is normally confirmed by ultrasound before the start of delivery. On day 2, 24 to 36 hours after the mifepristone, the woman is given misoprostol either orally or vaginally, causing her to go into labor. The misoprostol dose can be repeated every 3 hours up to 5 times. Usually, after 24 hours of starting the misoprostol, the woman will vaginally deliver the fetus. If the woman is having trouble delivering, she may be given a synthetic hormone called Pitocin to promote labor. Once the fetus and the placenta have been delivered and the bleeding is under control, the abortion is complete. Complication rates increase as the fetus grows. The major complication from induced abortion is incomplete abortion, in which pieces of the fetus and placenta are left behind. This requires surgical intervention. Other complications include cervical laceration, infection, hemorrhage, uterine rupture, and even death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma, including injury to the cervix. The purpose of an elective abortion is to ensure the delivery of a dead fetus. On the other hand, if a baby is wanted and the mother's health is in danger, the obstetrician induces labor or does a C-section and will have a neonatal specialist present to take care of the baby. As I mentioned at the beginning, I used to perform abortions. At the time, I truly believed I was helping women. Over time, however, I realized that abortion doesn't just end a pregnancy, it ends the life of an innocent, unique human being. As I cared for women in my OBGYN practice, I also learned how abortion harms women. I stopped doing abortions and I became a pro-life advocate. I am proof that anyone can change, no matter who they are or what they have done. I invite you to join me and make a decision to protect the preborn. Thank you for watching.
So far, we've discussed some of the medical and physical aspects of abortion. In Module 2, we'll discuss the reality of how abortion impacts women.